I am Nkosinathi Ndlovu, and this is the TechCentral Show brought to you by MTN Business. You can visit MTN Business on www.mtnbusiness.co.za, and we thank them for partnering with the show. My guest today is driving a revolution in healthcare by digitizing access. Kenna Health is the winner of the 2023 MTN Business App of the Year Award, and I'm joined in studio today by Kenna Health Chief Technical Officer, Pheello Maboea. Pheello, welcome to the show and thanks for joining us.
Thank you very much. Thank you for having me.
Yes. Pheello, so tell me what it means to digitize access to healthcare.
Basically, to me, it's basically using technology to enable access to healthcare.
Yes.
Technology allows you to do a lot in terms of expanding reaching people, and also at an affordable rate, which then forces you to break the chains that are currently existing in terms of brick and mortar that have limitations in terms of reaching people. So it's not digitizing for the sake of digitizing, right?
Yes.
Where you're just taking something manual and making it digital.
Yes.
You're trying to look at it from first principles basis to try and make sure that you're pulling out all the efficiencies, but leaving out only the important aspects of the journey.
Yes.
Of getting somebody the health care that they need.
Yes.
So then, by thinking about it that way, then you actually have to interrogate why. Why do you need a script on ink? Why do you need to present yourself at the doctor's office?
Yes.
And then you figure out, after you answer the whys, then you can figure out what type of solution can put in place.
Yes.
And the solution then, with the right objectives, then you can find ways to cut the fat and then the fluff, and then figure out exactly what your customer is actually looking for. So in certain instances, you may think that going to a doctor serves a particular purpose.
Yes.
It does. However, there are also other things that you don't necessarily have to see a doctor physically for, right? Then you start thinking about, but why would you engage with a doctor in the first place?
Yes.
And then does it have to be physical? When you start asking those questions, then you go like, is the building important? No, the building is not important.
Yes.
Do I have to see the doctor right then?
Yes.
No, you don't have to. Then you can start building technology in there. So you're not saying that your doctor is still going to have a doctor's office sitting somewhere,
Yes.
and then after that, all you're going to do is just have them on a system where they can talk to the patient and capture notes.
Yes.
You're saying, how do I enable a revolutionary view in terms of how you can deliver that healthcare? So now it poses interesting questions. What happens when you want to take readings from a patient? What happens when you want to keep that record? What happens when you refer to another doctor?
Yes.
Those are then all interesting questions that lead up to why you're digitizing healthcare.
Yes. So now tell me, it sounds like a lovely idea, right? I'm going to digitize this healthcare, but now as a patient, you tell me that my doctor's not going to be able to touch me. He's not going to be able to even, yes, as I said, touch. How then are patients responding to this?
We have segments of patients.
Yes.
There are people that are loyal and dedicated to their GPs. That's cool. That's the type of service that they require. And also there are things that allow them to do that. A long-standing relationship with a doctor, probably you're on medical aid,
Yes.
probably there's proximity of where the doctor is placed.
Yes.
That's cool. And then you have people that go to a doctor sometimes, so they don't even mind who the doctor is. They just need a service to
Yes.
be delivered.
Yes.
Like I, for instance, for the longest time, I never really had a doctor. I just went to where a doctor was.
Yes.
And then, so that's kind of part of our target. And then there's another segment which is very within that target, which is very comfortable with using technology, and they already are getting healthcare services through some digital means. Or then there's also other people that don't have the luxury of a private doctor, right? Now this is then out of need, where it's like, okay, cool, I am going to shop for the best deal in town to try and figure out where is the best place for me to get healthcare. So now on this spectrum, there are trade-offs that you make in terms of cost, time, as well as the access. So users or patients then continuously have to make that provision.
Yes.
Like while we all may want to talk to the almost absolute specialist for anything that we want to talk about that might be ailing us, we don't all have that luxury. And in true form in South Africa, it's a very small segment of our market that can actually access that. So it's like, then you're actually looking at the fact that if I do away with all that makes that trip to the doctor a thing, how much further can I draw down that price? Because at that point, I'm seeing that there's a segment of people that have a cost issue, which is directly related to the access issue. Then you can then go like, okay, cool. What do these people value?
Yes.
Are they coming to me for the doctor to touch them?
Yes.
Or are they trying to feel better? And that's the thing that we are looking for. We are looking to make people feel better.
Yes.
That's what.
Okay, so that's great. So let's say I now get over whatever psychological hurdle I have towards, having a consultation through some kind of video medium.
Yeah.
Right. There are, I imagine, certain risks that are different. Now, in a bricks and mortar environment, for example, if someone eavesdrops on this conversation that I'm having with my healthcare provider, the healthcare provider or the provider of the infrastructure is not really going to get as much trouble as you, as the CTO, who builds, the infrastructure required to provide a video service and has to handle that data, right? So can you tell me about those risks and how you've thought through and worked through them?
They are not necessarily new in the sense that in anything that you do using your smartphone or your laptop, there's always a risk of somebody just hovering over you, right?
Yes.
And it's just eavesdropping.
Yes.
And like it's in the, let's say the operating procedure that we have with our clinicians is that one of the main things that we do. So we deliver the consult either via text chat or via a phone or a video call, right? In the moments where it turns into a video call and a call, you would treat it as having a sensitive call. So you would ask the patient if they're in a comfortable place to have the conversation, and then if they say yes, that's the onus that's on them to make sure that they are in a place where they can have that conversation.
Yes.
But that is always part of our procedure to make sure that information is as far as possible. We are talking to the right person. Yes. Number one, the person that the doctor says, oh, this is Nkosinathi. And then if Lindy suddenly shows up, then we have to go like, something is not right here.
Yes.
Right. So these are some of the risks that we have. But then this is mainly on the operating procedure that we have with our doctors, because also they were practicing doctors in brick and mortar places. They also know that you can't bring Nkosinathi's file and then all of a sudden Lindy shows up. That is not, So those are some of the things that we look out for in the operating procedure. But in general, the information that you share with us on the app is completely only people that can see it are the clinicians, and it's not clinicians looking at it for fun. It's clinicians only when you're consulting. Right?
Okay.
So we have lockdowns in terms of the data that you're accessing.
Yes.
So and then that information belongs to you. So if you want your account deleted, you can ask us to delete that account for you.
Okay.
And then you can also view that information in terms of historic. And that's one part of the business that we're probably going to expand on an ongoing basis, so that you can look at your consultations and some of the outcomes for those things. Because we're trying to make sure that you're looking at your overall well-being and not just coming to us when you're sick and just doing a consult.
Yes. Now, speaking to that, I mean, having this consultation in a more data-driven kind of format opens up some possibilities, right? Whereas a live doctor would have to read your file and think about it in real time. If it's data sitting somewhere, an algorithm could look at it and it could compare it to some other file and maybe even say, hey, these two patterns are the same and that one led to cancer. Doctor, maybe you should test for such and such a thing. How are emergent technologies like ML and AI kind of working themselves into healthcare?
Yeah. It's an interesting time now that the GPTs have helped us not to try and build all these things from scratch.
Yes.
But basically, yes, there is a lot of value in terms of the data that we get from our patients. The value to the patient is that we keep a very clean record of their experience with us, so that we know exactly what we've been interacting with them on. So we can tell that you had flu, you had a broken leg. So if there's ever a chance of these things conflicting in some ways, our doctor will have a view of that, right? So that is still akin to reading the file.
Yes.
Then there is another component, which is then what does the population of a particular segment look like health-wise? Then you're then able to go like, okay, cool. In this region, this is how people are. There's a particular trend in terms of the illnesses that we are seeing. There's a particular comorbidity that creeps up sometimes. So what we're looking at there is then trying to figure out if they are, even in the way that we allocate doctors, is there a way that we are then able to figure out if we have a doctor that's best placed to service this particular population.
Yes.
And then there are other tools that we are looking into, or probably over the next year or two, in terms of how do we then make the experience for the doctor as easy as possible. Right now, the patient just interacts with the doctor with our interface, and that's cool. But then the doctor is also on the side, on the doctor side, on the expert view, essentially, is that they have a lot of data to make sense of. So can you imagine finding yourself as a doctor and then you're dealing with patients on an ongoing basis? It's not necessarily the most, it doesn't have that luxury of you spending time reading the document and spending time and all that stuff. What you want to do is to figure out summary views, then make it easier for the doctor. So the summary view could be basic descriptive stats around what the patient has been looking at, but then we could also figure out some predictive steps that we can put in, so that you can go like, okay, cool, here is something here. Maybe the high blood range has not been going down the way that you're expecting it. Maybe there's something for you to intervene here.
Yes.
And then so that's the element of it where we want to deliver brief insights to the doctor. So can you imagine a scenario where when you get into my queue and then I click on you and then there is a brief summary of why you are here today, but then there's also a brief summary that is auto-generated to give you a synopsis of the entire encounter experience that we've had over the past couple of interactions that we've had. These are some of the things that we can plausibly do in the next couple of years. And then also even on the patient side, there is the element of the level of advice that we can give before you actually need to talk to a doctor. Right? So just looking at tools that you can put in place to basically triage what you're actually going through, and maybe there are some low-level interventions that we can put in place. Should our bot fail, then we can escalate it to a doctor, right? Because at the end of the day, what we're trying to do is that you get the care that you need.
Yes.
Not necessarily for you to see our doctor or nurses, right?
Yes.
So we're trying to make sure that you can get the help that you need. If you need guidance, you need a further explanation on or actual consultation, because certain things you can't do without a doctor.
Yes.
Then we can escalate them properly. And I think what we forgo in not necessarily trying to push consults is that we build a brand that people can trust. That we are always trying to make sure that the cost of care for them is as cheap as possible, but it is very good quality. So even with that said, the reason why we have not jumped to get all these things done is that we need to make sure that the tech is sound. We need to make sure that we are going through our due diligence to make sure that the bot is not going to hallucinate something, or, it's not going to come up with something that is contrary to what we have in our SOPs. So we're trying to make sure that we can ring fence it, because that's probably one of the ways to just get started, is just ring fence it to particular conditions, and then after that you can escalate from there. But you can't just go like, hey, just
let's run free.
Whatever.
But in your answer there, you did touch on designing specific things for doctors and designing specific things for patients. I can imagine that from a UI design perspective, you would have to kind of split your brain between these two users that you have in your system. Could you tell us more about that process?
Yeah, so we go through a very deliberate product development process that we follow. This is where we include our product people, our customer insights people, and our technical people in a process that makes that for anything that we want to do, that it makes it easier for anybody that is interacting with the system, right? Because, and I go back to why we exist. We exist to deliver quality care at an affordable price point.
Yes.
So then what that means is that how do you then efficiently cater to our customer base at the most affordable rates? Which means that when you step into creating personas, creating users on our system, we have to step into their shoes in terms of what do they experience. There are things that a patient knows that the doctor doesn't know. Then there are things that the doctor knows that the patient doesn't know. And because of those two different positions, you have to be empathetic to what they will be experiencing at the time that they are using the platform. So on the doctor view may be a little bit more complicated. It's complicated if you're approaching it from the eyes of a patient, because you don't know what all of those things are. And it's not necessarily your business to know what those things are.
Yes.
But because a doctor or a nurse or our clinicians are trained, they can understand the information hierarchy that we put on the page, where we put the information, and how do we then figure out the best place to put certain information at what point of the consultation.
Yes.
So we also collaborate closely with them. We call them our SMEs. They come in to tell us, no, this does not make sense. If you position that number like that, it might draw this other outcome that you might not know as a person that's like a designer or an engineer, right? That's what we're looking for. And then when you're looking at the patient experience, is that you are aware that the person that is coming to you is actually coming to you at a very vulnerable place. So what you want to do is to make sure that interface is clean, that the instructions are clear. There's a flow that they can always understand where they are at any given point, and you're always empathetic with interacting with them. So then that complexity that the patient doesn't experience is an experience on the other side. So that that experience can be easy for the patient.
Yes.
But then you're not just throwing it to the doctor side, but you're also going like, okay, cool, there's some complexity that we need to deal with, and then how do we simplify it for the doctor?
Yes. So you structure it in a way that it can work.
Yeah.
That's excellent. So now, did all of this development happen in-house?
Yes, a large chunk of it. At the beginning, we had a technology partner. However, we transitioned a little bit, but pretty much most of the tech that we built is ours. We were fortunate in the sense that we had been in telemedicine for a while with our other entity, Health Force, so we understood the clinician experience a lot. So then we were able to translate some of those learnings into Gena, which made the build of Gena itself much easier than starting from basics. So we were then able to focus on what the user experience would be, because that was our first foray at actually having a patient relationship. Because in our other incarnation, we had a nurse intermediary in between that would deal with the nurse, with the patient. So yes, we went out to find the best talent that we could in terms of the UI design, patient experience, in terms of customer insights, and then also on the technical front, people that are very comfortable with mobile engineering, that understand scaling of a product like this, usability in all fronts. We had to give it that level of attention.
But I mean, in terms of the tech skills market, it is a seller's market at the moment. But you did mention something to me called purpose-driven recruitment. Yes. Could you tell me more about that?
Yeah, as you said, it's a seller's market. Technical skills are at a high demand, and people are willing to pay top dollar for for good people in the market, and we also do. We want to make sure that people are fairly compensated.
Yes.
But when you go into the market, you're competing with other startups,
Yes.
well-funded startups.
Yes.
Not only that, you're also competing with corporates,
Yes.
and then also you're competing with international multinationals, right?
Yes.
So if I'm competing in that realm on money alone, I'm
Yes.
going to lose all the time.
Yes.
All the time. And what then has become important to us, it has always been a philosophy that we've had, is that we actually want to work with people that understand why we're doing what we're doing. So part of our conversation at the beginning is not, it is to figure out if you're technically proficient, but part of it is that, does this problem resonate with you? Do you feel like this is a problem worth solving? So that's the conversation that we have with people that we recruit, so that they understand why they're coming to work at Ghana,
Yes.
because the problem means that much to them. Then when conversations, and we've had a couple of these where you have to counter, then there's a counter in terms of salary.
Yes.
Then you have to think about, because I can only go so far.
Yes.
Now it's a decision on you whether is this problem not good enough for you to work on.
Okay.
And sometimes you have to lose some people to that, but then it's also okay that you lose them, because down the line, when you're actually working in the business, you need to make sure that you are the right fit for the organization in terms of wanting to solve this problem.
Yes.
It helps us a lot in terms of the level of thinking, the level of innovation that people bring to the organization, and also in terms of retention. For as long as the organization stays true to the commitment of trying to reduce the cost of affordable care,
Yes.
then I know that I will have a cohort in the team that
Yes.
is not going to go anywhere, because they feel like this is a problem worth solving.
Oh, okay. That's great. So you get to keep more people because they're one with the mission. But tell me about modeling this problem now, because obviously you have these doctors. Are your doctors employed by you, or do you rent a doctor, for 2 hours when you need them? How do you ensure that you always have enough resources to deal with the demand?
Cool. So we hire our doctors outright for a number of reasons. One of the first ones is quality management. We want to make sure that we're hiring the right people. Segueing from what we just talked about in terms of technical expertise, even clinicians are in demand as well. So you're also looking for the right type of people that will understand why they're doing what they're doing.
Okay.
So then it helps us in terms of the quality assurance that we promise to our patients. And then on top of that, hiring doctors outright allows us to have some level of flexibility in our unit economics, because then we can then model how many patients to a clinician relationship. We can figure out what that looks like, and then recruit as it goes along. The alternative, when we talk about unit economics, is that it would be much cheaper for us to to follow an Uber model. But then the risk of bad players or advice that does not necessarily follow our SOP is escalated. And then what then happens is that you have a direct escalation between the number of clinicians that you need versus the patients that are coming in, right? For our model to work, we need to be able to have economics that don't necessarily scale that way. Because if I am hiring a doctor every time somebody wants to consult, it means that I'm not actually sorting out the inefficiencies in the system.
Yes.
What I'm trying to do is to make sure that we can service as many consultations as possible with limited clinicians. So then we figure out the efficiencies that we need to put into place in terms of the tools that we provide to the clinicians, the support that they need, the learning and growth that they need to go through in order to support that. So that becomes our edge, essentially, because at a certain point we would actually want to go out and go like, amidst everything that's happening,
Yes.
we would like to reduce our consultation fee. Our consultation fee right now is 185. At some point, we would like to say that, we've built up so many inefficiencies in our system that we can go to 150, go to 100 Rand, deliver a service for 50 Rand. That will be like a nirvana for us, because then at that point, we are truly making it accessible for people that desperately need the service.
Yes. So the space you're in, though, it is quite competitive. You've got some local competitors coming along, international guys coming through as well. But it's not necessarily as cutthroat as one might expect, because of the nature of conscientizing people to what it is that you do. So what kind of efforts do you make to get people to accept this mode of delivering healthcare?
This has been an interesting journey for us.
Yes.
In the sense that when we launched, there was a segment of the market that understood what telemedicine is. However, it was not at the level where it can grow itself. So while some big insurance companies had telemedicine services, the uptake on them was not that great for them to be a understood way to deliver meds. And some of the conventions that you alluded to earlier on about being touched and being serviced by a doctor like that still remain very strong. So then what then happens when you start looking at competitors coming into the market is that you actually welcome competition, because then you are sharing the burden of teaching
the
marketplace what telemedicine is, right?
Okay.
Then you can figure out how to niche after that.
Yes.
Okay, cool. Now you know what telemedicine is.
Yeah.
This is what we do in that mode.
Yes.
Because what part of the problem at the beginning is trying to tell somebody what telemedicine is, its limitations, and then after that going like, now that you are bought into the idea of telemedicine,
here's who I am. Yeah.
Right. It's a long journey, but it's one that was necessary, I guess, for us to walk it, because it enables other entrants in the market.
Yes.
The more some of these entrants come into the market, the greater it is in terms of the entire healthcare system.
Yes.
And then because we are actively working on the same goal, digitizing healthcare and providing it at affordable rates, then it means that over time, then we are able to either cooperate, or even if we don't cooperate, then the little competition that comes up in the market gives consumers choice, and then we're able to drive down
the price. Yes. But having competition does legitimize the competitors themselves.
No, it definitely does.
Yes.
It definitely does, because it's a big ask, right? To ask somebody at a point of need, especially when it's like, I'm sick, and then you're going like, yo, try this other thing, this new thing.
Yeah. And I'm the only one who does it.
And I'm the only one. I'm like, okay, no, maybe. Right? It becomes a little bit better. You go like, remember when you wanted to renew your contraception, and then you went onto that other app?
Yes,
same
it's
thing
the
on
same
the side.
thing.
And now we can service your stomach bugs, your flus, right?
Yes.
Those type of things. The conversation becomes a little bit easier, because also there's also like trust things that need to be sorted out in terms of people trusting that you're going to give them the right level of care, that the prescription that you give them is actually going to be useful, that when they pay that money, it's actually you're only going to debit only that 185 Rand, right?
Yes.
Those are the things that then people have to get over in terms of using a platform like ours. It's akin to using e-commerce sites earlier on, where you're trying to where you're going like,
will I get my delivery?
Will I get it?
Yes.
What if it's wrong? Then you have to figure out the returns thing. And one of the other things is that people tend to now that Uber is ubiquitous, you start to think, it's Uber, right?
Yes.
But they don't remember when they first used Uber, or the early adopters used Uber, where they were going like, is it actually going to get here?
Yes.
And then who is driving this thing?
Am I safe?
Am I safe?
Yeah.
Am I gonna get where I'm going?
Yes.
And then how do I pay? Right? Those things now that Uber is just a thing now, don't seem like big problems. But for early entrants in the market, those are things that you have to grapple with.
Yes. It's been developing trust. Talking about winning. So you were recently at a gala event, and not only did you win the category of Best Health App, but you are the 2023 MTN Business App of the Year award winner. Tell me about the feeling, as a technical lead.
It's a weird one. It's a weird one. In all honesty, I think was fairly confident of the category one.
Yes.
Because I really do bet on the product that we've put out in the market. Really we've seen customer reviews, we've had customer interviews, and everybody that actually uses the app is just like, wow, this is great.
So you were sure you were the best in your hood?
In my hood, I was like, yeah. Nobody can tell me anything about this, right? And I was like, I mean, like there are things that we know of that people don't know of, but it's like for what we presented out into the market, I'm pretty confident that the category one is sure. Yes. Like even if it wasn't, then we will go back to the office and go like,
something's going on. Something, but then it actually went in the opposite direction.
And I'm not trying to denigrate our partners, our fellow nominees.
Yes.
But I truly believe that we put in a lot of effort to make sure that we are delivering a fantastic product into the market. The overall winner, and I was not expecting at all. There was a big surprise, and I think if you look at some of the pictures of that night, there's a moment where me and the CEO are looking at each other and like, what?
So that mission-driven, that purpose-driven philosophy is actually making waves.
I think so. I think there's a great. I think people are starting to understand what we're trying to do. They're starting to understand what we are trying to introduce into the market. And the other important thing is that even in trying to do something new, we're not trying to compromise their experience, because whenever you build something, it's not necessarily that I am competing with other healthcare providers. I'm also competing with anybody else that delivers information to you, because then you start learning how to use certain apps, and then if my app starts working weirdly, then you're gonna go like, what is this now, right? So now then you have to keep on trend in terms of what Checkers is doing with their 60/60 app, right? You try to figure out what are they teaching consumers about expectation management there.
Yes.
Take a lot is doing, same thing, right? Because then when you start looking, if I only looked at healthcare apps, and we must all admit that healthcare doesn't necessarily always get the right level of treatment. Yes. Like you see some of the software that is out there in the market is just like Windows 95, right? If I only looked at that, then I will give you a very functional thing. But then I will miss out on all the valuable insights that companies like Uber, Checkers, that they have sorted in terms of what happens when you introduce a new category?
Yes.
What is that experience for a user for them to gain that trust, right? Then those are the markers that you then have to put into your app. How do you make it as simple as possible but being as effective as possible? Those are some of the things that you then have to figure out.
Yes.
And that's not necessarily in the industry that you're in. It's probably something way outside that you might not even consider. So to win the overall winner, then goes like, oh, okay, cool. We are looking at the right things.
You're learning from others in industry. Okay, excellent. Pheello Maboea, thank you for your time and all the best with Kenna Health.
For sure. Thanks a lot for having me.
Thanks.